Tell us in the comments which city you're watching from, and if you believe stories like this deserve to be heard, hit that subscribe button. Dr. Michael Chen delivers pizza in Chicago, Honda motorcycle, thermal bag, 8 to 10 deliveries daily. He's 44 years old. Minimal conversation with customers. Nobody knows this man worked as a heart surgeon at Northwestern Memorial for 20 years, saving thousands of lives. He lost his license after a malpractice lawsuit until the night he delivered to a house where a baby was being born. Tony's Pizza in North Chicago is a neighborhood restaurant. During evening rush hour, it experiences its busiest times, and quietly working in the middle of this chaos is one man, Michael Chen. 44 years old, medium height, riding through city streets on his black Honda motorcycle. Red Tony's Pizza shirt, black pants, thermal delivery bag. Average 8 to 10 deliveries per day, works 6 days a week. Michael has been doing this job for 3 years. Restaurant owner Tony Ricci had been curious when he hired him. "Mike, you seem very educated for this job. What did you do before?" "I worked in healthcare. Now I want something simpler." "What position?" "Various roles. It's in the past now." Tony didn't ask more. He seemed reliable, came on time, no customer complaints. Michael was a quiet worker. He'd make brief chats with other delivery guys, Jake and Carlos, take his pizza, and go on his delivery. "Mike, you're very different," Carlos had said one day, "like you came from some very important job." "Everyone comes from somewhere, Carlos. What matters is being here now. But look at your hands. So clean, so careful, like you're a doctor." Michael had been uncomfortable. "I just like cleanliness." But Carlos was right. Michael's hands were different. Surgeon's hands. Hands that had performed thousands of surgeries for 20 years. Michael's past was complicated. He graduated from Northwestern University Medical School in 1999, specialized in cardiothoracic surgery, became attending surgeon at Northwestern Memorial Hospital in 2004. For 20 years, he performed the most critical heart surgeries: bypass surgery, valve replacement, heart transplants. He was one of Chicago's most respected surgeons. He had a perfect track record, thousands of successful surgeries, papers published in medical journals, teaching positions, mentor to residents. But everything changed in 2019. Margaret Sullivan, 67 years old, complicated mitral valve replacement surgery. Michael came out of the 14-hour surgery exhausted and stressed. He made a small oversight in post-operative care, timing error in anticoagulation protocol. The patient had a stroke, permanent brain damage, vegetative state. The family filed a lawsuit. Hospital investigation began. Media attention, peer review, professional scrutiny. Medical board decision, gross negligence, patient safety risk. License suspended, career finished, reputation destroyed. His wife Jennifer asked for divorce. "Michael, I can't trust you anymore. Not with your patients, not with us. Custody battle over children, house foreclosure, media harassment. Michael lost everything. 20-year career, family, respect, financial security, depression, anxiety, PTSD. He got 2 years of therapy, but working in the medical field became impossible. In 2021, he started pizza delivery in Chicago for a fresh start. Anonymous, simple, no responsibility for lives. Nobody knew Dr. Michael Chen, just Mike, the pizza guy. Until that night when a routine delivery changed everything. February 14th, 2025, Friday night. Valentine's Day, more pizza orders than usual. Michael was making his last delivery. A townhouse in Lincoln Park, large pepperoni for a young couple. Address 1247 West Fullerton Parkway, Apartment 2A. Michael parked his motorcycle, took the thermal bag, walked to the apartment door. He called Unit 2A from the intercom. Pizza delivery. Come up second floor. Michael climbed the stairs. Found door 2A, knocked. A young woman opened the door, Sarah Martinez, 28 years old, but she looked nervous, stressed. "Your pizza's here," said Michael. $24.50. As Sarah was paying, a man's voice came from inside. "Sarah! Something's wrong." Sarah panicked. "Oh God, David! I'm coming." Michael was curious. "Everything okay, ma'am?" It's complicated. My boyfriend, he's not feeling well." More urgent voices came from inside. "Sarah! Call 911! Something's really wrong." Sarah tried her cell phone, but the battery was dead. No landline. "Ma'am, can I call 911? said Michael. "Yes, please." "David's having chest pains." Michael immediately called 911. 911, medical emergency at 1247 West Fullerton Parkway, Unit 2A. Adult male, chest pain complaint. Ambulance dispatched, ETA 12 minutes. Sarah ran inside, Michael followed. In the living room, David Rodriguez, 31 years old, was sitting on the sofa, clutching his chest. "Can't breathe. Chest hurts so bad. Feels like an elephant sitting on me." Michael immediately recognized the symptoms. Classic myocardial infarction presentation, heart attack. Medical instincts kicked in. 20 years of training had developed automatic responses. "Sir, how long ago did the pain start?" Michael asked. About 30 minutes ago, getting worse." "Any radiation to left arm, neck, or jaw?" David was surprised. "Yes, left arm hurts too." "How did you know?" Sarah was also surprised. "Are you a medical person?" Michael hesitated. He didn't want to reveal his identity. "I have some first aid training." But the situation was critical. David's skin color was changing, diaphoresis had started, probable cardiogenic shock developing. 12 minutes might be too long for the ambulance. Michael made a decision. Patient safety first, personal concerns second. "Ma'am, David is having a heart attack. We need to act immediately." "Heart attack? But he's only 31. "Age doesn't matter. Do you have any aspirin in the house?" "I think so, in the bathroom." "Bring it. Also, any nitroglycerin tablets?" "No, we don't have that." Michael assessed David. Pulse thready, blood pressure probably dropping. Oxygen saturation likely decreased. "David, I need you to stay calm. We're going to help you, but you need to cooperate." Sarah brought the aspirin. "David, chew these aspirin tablets. Don't swallow whole, chew completely." "Why?" "Faster absorption helps with blood clotting prevention." Sarah became suspicious. "How do you know so much about this?" Michael avoided the question, television medical shows, but his actions looked too professional. The way he assessed vitals, used medical terminology, made clinical decisions. David's condition was worsening, chest pain intensifying, shortness of breath increasing. "I think I'm dying," David said weakly. "You're not dying," Michael assured him, "but we need to keep you conscious and breathing." Michael positioned David optimally. Slight elevation, comfortable breathing position. "Sarah, is there any family history of heart disease?" His father had a heart attack at 40. "Any medications David takes?" "Just vitamins, nothing else." Michael did a mental calculation. Young male, family history, acute presentation, likely genetic predisposition plus lifestyle factors. 8 minutes passed, 4 more minutes until ambulance arrival. David suddenly grabbed his chest, pain intensifying. "Oh God, it hurts so much," Michael realized. Patient potentially going into cardiac arrest. No medical equipment, no backup, no hospital resources, only his knowledge and experience. Critical decision moment. Reveal identity and provide advanced care, or maintain anonymity and risk patient death. David's pulse was weakening rapidly. Michael made his choice. "Sarah, I need to tell you something," Michael said seriously. I'm not just a pizza delivery guy. What do you mean? I'm a doctor, former cardiac surgeon. I can help David, but you need to trust me completely. Sarah was shocked. You're a doctor? Why are you delivering pizzas? Long story. Right now, David needs immediate medical attention. His condition is critical. David was barely conscious now, pulse very weak, skin pale and clammy. Michael completely switched to medical mode. 20 years of training took over. Sarah, David is going into cardiogenic shock. The heart attack is severe. The ambulance will arrive in 4 minutes, but we can't wait. What can we do? I'm going to perform emergency stabilization procedures. But you need to help me. Michael assessed David professionally. Pulse 120 and thready. Probable systolic BP below 90. Signs of heart failure developing. Sarah, do you have any medications in the house? Blood pressure pills, diabetes medication, anything? My grandmother left some pills when she visited. I can check. Bring everything. Also clean towels, bottled water. While Sarah got the items, Michael worked with David. David, listen to me. I'm Dr. Michael Chen, cardiac surgeon. You're having a serious heart attack, but I'm going to help you. David's eyes opened slightly. Doctor? Really? Yes, I need you to stay awake and keep talking to me. What's your job? Software developer. Work from home. Good. Any chest pain before today? Sometimes, after climbing stairs, ignored it. Classic warning signs. Michael realized this wasn't David's first cardiac event, probably unstable angina leading to full MI. Sarah returned with medications. Found these. Michael checked the bottles. Metoprolol 25 milligrams, beta blocker. Amlodipine 5 milligrams, calcium channel blocker. Grandmother's blood pressure medications. Sarah, when did your grandmother leave these? 6 months ago. Are they expired? Michael checked expiration dates. Still good. David, have you ever taken blood pressure medication? No, but grandmother said I should check. Michael calculated dosage. Without IV access, EKG, or lab values, this was risky. But David's condition was deteriorating rapidly. I'm going to give you a small dose of medication to help your heart. But first, I need baseline information. Michael checked pulse again. 130, irregular rhythm, probable atrial fibrillation developing. Sarah watched amazed. You really are a doctor, the way you're examining him? Sarah, I practiced cardiac surgery for 20 years, but I lost my license due to a malpractice case. That's why I deliver pizza now. What happened? A patient died due to my error. The medical board banned me from practicing. David spoke weakly. Doctor, even if you made a mistake, please help me now. Michael experienced an emotional moment, a patient trusting him despite knowing his history. David, I will do everything possible to help you, but you need to understand, I'm not officially licensed anymore. This is emergency intervention only. I understand. Just don't let me die. Michael broke a metoprolol tablet into quarters. David, place this under your tongue. It will help slow your heart rate. Is this safe? Under normal circumstances, I'd have full cardiac monitoring, but your heart rate is dangerously high, and this medication can help. 3 minutes until ambulance arrival. David's heart rate slightly decreased, 115, still irregular, but more stable. Michael continued assessment. Sarah helped me elevate his legs. Improve blood flow to heart. They positioned David optimally. Doctor, Sarah asked, will he survive? Michael gave an honest response. David is young, which helps. But this is a serious heart attack. The next few hours are critical. Sirens approaching in the distance. Ambulance coming, Michael announced. David, you're going to the hospital now. Tell them Dr. Michael Chen provided pre-hospital care. Will you come with us? David asked. Michael paused. Going to the hospital meant questions, possible legal issues confronting his past. I can't, but I'll make sure the paramedics have all the information. Paramedics arrived. 2 EMTs, experienced crew. "What's the situation?" the lead EMT asked. 31-year-old male, acute myocardial infarction, approximately 45 minutes onset. I provided aspirin therapy and small-dose metoprolol for tachycardia. Family history positive for cardiac disease. The EMT looked at Michael suspiciously. "Are you a medical professional?" "Former physician." The EMTs began their assessment. EKG, IV access, oxygen, cardiac monitor. "Good call on the aspirin and beta blocker," the EMT commented. "Heart rhythm stabilizing." As they prepared David for transport, Sarah approached Michael. "Doctor." "Chen, thank you. You saved his life. The paramedics will take good care of him now." "But why are you delivering pizza? You clearly know what you're doing." Michael looked at David being loaded into the ambulance. "Sometimes we make mistakes that change everything. But tonight I remembered why I became a doctor in the first place," David whispered as the stretcher passed. "Thank you, doctor." Chen. The ambulance drove away, sirens fading. Sarah stood with Michael in the hallway. "What will you do now?" Michael reflected. "I don't know. But tonight showed me that medical knowledge doesn't disappear, even when the license does. Maybe this is a sign. Maybe you should try to practice again." Michael was quiet for a moment. "Maybe. But first, I need to finish pizza deliveries." Sarah smiled. "Pizza deliveries can wait, doctor." Lives can't. The next morning, Michael came to Tony's Pizza at the normal time, but felt different. For the first time in 3 years, he had used medical skills, saved a life. Tony was curious. "Mike, how was last night? You came back late from the last delivery." "The customer had a medical emergency. I helped until the ambulance came." "Did you have medical training?" Michael paused. Was there any point in hiding it anymore? "Tony, I need to talk to you." They sat in the office. Michael told his story. Medical school, 20-year career, malpractice case, license loss. Tony was shocked. "You were a real doctor? Why didn't you tell me?" "I was ashamed. I felt like a failure. I wanted a simple life. But last night you saved a life. That's not failure." That afternoon the phone rang. From Sarah. "Dr. Chen, I wanted to give you an update about David's condition." "How is he?" "Stable at the hospital. The doctor said you probably saved his life. The pre-hospital care was excellent." "I'm glad." "Dr. Chen, there's something else. The cardiologist at the hospital, Dr. Williams, wants to speak with you." Michael was scared. Would there be legal problems? "About what?" "Positive things. He was impressed with the care you gave David." The next day, Michael went to Northwestern Memorial for the first time in 6 years. Dr. James Williams, cardiology department head, met him in his office. "Dr. Chen, do you remember me?" Michael remembered. Williams had been a resident when Michael was his attendant. "Of course, James." "How are you?" "Good, Michael." But the real question is, how are you? Michael answered honestly, "I felt lost until last night. I reviewed the David Rodriguez case. Perfect pre-hospital management, clinical judgment excellent. Thank you. Michael, we miss you at the hospital and the medical community. But I don't have a license anymore." License reinstatement is possible, especially after a life-saving act. Character references, peer review, gradual return program. Michael felt hope for the first time in years. Is it really possible? "We can work with the Illinois Medical Board, but do you want it to return to medical practice?" Michael thought. Pizza delivery was safe and simple, but medical practice was meaningful, purposeful. "Yes, I want it." 6 months later, Michael attended a hearing before the Illinois Medical Board, character witnesses, peer references, psychological evaluation. Dr. Chen, the board chair, asked, "Why should we reinstate your license after a serious malpractice finding?" "Because I've learned from my mistake. Therapy helped me understand what went wrong, and recent events showed that my medical judgment remains sound. David Rodriguez also gave testimony. Doctor Chen saved my life. Without his intervention, I would have died before the ambulance arrived. Dr. Williams supported him. Doctor Chen was an excellent surgeon before the incident. He deserves a second chance. Board decision, limited license reinstatement, supervised practice, gradual independence, ongoing monitoring. Michael accepted gratefully. Northwestern Memorial offered a position, cardiac surgery, fellow supervision, teaching residence, gradual return to OR. On Michael's first day back, a white coat ceremony was held. Small gathering, colleagues, friends. Tony came too. Mike, I'm so proud of you. But if you want to return to pizza delivery, your job's ready. Michael smiled. Tony, always remember, everyone deserves a second chance. Dr. Williams gave a speech. Medicine is about healing, not perfection. Dr. Chen's journey reminds us that mistakes don't define us. How we respond to them does. Looking at patients, Michael realized pizza delivery had taught him humility, developed empathy, changed his life perspective. Now he was a better doctor, more compassionate, more careful, more grateful. 6 months later, Michael got his full license back, started independent practice, but he still sometimes visited Tony's Pizza to see Carlos and Jake. Dr. Mike, Carlos greeted excitedly. How's medical practice? Good, Carlos. But I don't forget my pizza delivery days. They taught me important lessons. What lessons? Humility, service, second chances. And most importantly, helping people doesn't require a title. It requires heart. In Michael's office hangs David Rodriguez's thank you letter. Doctor Chen, you saved my life twice, once medically, once by showing that everyone deserves redemption. Dr. Michael Chen, cardiac surgeon, lifesaver, second chance believer.